Hello, everyone. This is Dr. Kamyar Hedayat, co-founder and chief scientific officer of Systems Biology Research Group and chief architect at the GEMMA Bioanalytical System. In this talk, I'm going to give you an introduction to the science of endobiogeny and discuss opportunities to train in the course on the science of endobiogeny. Let's begin by talking about the theory and what it is. In this part of the talk, we're going to discuss the theory, the practice of endobiogeny and its practical applications, how endobiogeny can improve your approach to healing, 4 essential understandings as a takeaway, and then we'll conclude this section by comparing endobiogeny to other forms of standard and holistic medicine. Let's begin. The Eastern approach to healing is a whole systems approach, but it's based on the concepts of forces and elements, of doshas in the Ayurvedic system, of wood, of fire, of water, for example, in the Chinese medicine approach. The system has a lot of value because of the holistic approach to thinking, but some of the terminology doesn't correspond to how we think in our modern scientific way. In contrast, endobiogeny is also a whole systems approach to healing, but it's based on the concept of physiology and it uses the language that we're familiar with as medical doctors. What is the theory of endobiogeny? It's an understanding of the interconnectivity of all living beings and all the elements within the being, of how metabolism, physiology, perception, psychology together can either maintain health or cause disease states. So the advantage of this approach to holistic medicine is that it respects the whole person, but it's rooted in contemporary science and the type of evidence-based approach that we're accommodated to and expect. And because endobiogeny was created by physicians for physicians, all treatment possibilities are considered, both standard pharmaceutical, traditional healing modalities, lifestyle, diet, and anything else which is appropriate to help the patient return to a state of health. So when we talk about the theory of endobiogeny, what we're studying is metabolism, because metabolism is life. Life is composed of these two aspects of catabolism, which is breaking down material, and anabolism, which is building it up. And metabolism can be the transformation of food, of energy, of tissues, of ideas, any type of dualistic concept of breaking down and building up is a type of metabolism. And because life is orderly, the process of metabolism must be orderly as well. And something has to be managing and ensuring that metabolism is coherent, and that is the endocrine system, because hormones are the master regulators of metabolism. For example, we know that cortisol is catabolic. We know that testosterone and estrogen are anabolic. And thus, in this way, we see that hormones are able, at a high level of management, to set the pace for a certain type of metabolic orientation. So hormones are able to ensure coherence, order, and a larger plan of life that allows human beings to go from merely surviving like other animals to thriving. I want to make a distinction between metabolism and physiology because ultimately endobiogeny is an approach to integrated physiology. Because while metabolism is the essential function of biological life, it's physiology that ensures that metabolism occurs. It is physiology, which is the process of all the factors that allow nutrients to be delivered to the tissues for metabolism to occur and waste products to be removed. But endobiogeny doesn't look at physiology in the standard approach. Our approach is one of integrated physiology. We're looking at how all the different levels of the organism are maintaining connection and coordinating their levels of activity between the cell, the tissue, the organs, and the human being as a whole. So we're looking at these multi-scaled interrelationships of structures and functions. The benefit of this approach is that it allows for a clear understanding of the origin of nearly all disorders. For every disorder, endobiogeny has a way of characterizing the specific types of imbalances and the specific levels of management of metabolism. And this is how we're able to propose root cause treatments rather than simply suppress the mechanisms of pathophysiology. So let's put all this information together to show you what integrative physiology looks like. We have this overarching concept of metabolism. We have these two branches of metabolism, catabolism, which is breaking down, and anabolism, which is building up material. And we have the endocrine system, which is the manager of metabolism. In endobiogeny, we organize hormones into 4 general families of activity based on the general metabolic orientation of those hormones. And then finally, we integrate the function of the autonomic nervous system represented to your left with parasympathetic, alpha sympathetic, and then beta sympathetic. And then finally, as part of this integrative and holistic model, we understand different detoxification organs as playing a critical role in helping the body manage the waste products as a result of metabolism. And of course, we can't forget or overlook the importance of mind and the concept of perception of stress and how our mental perceptions of stress affect our physiologic response to stress. As I mentioned earlier, from the perspective of endobiogeny, all disorders are fundamentally an imbalance of the elements of physiology and metabolism. So for each disorder, we have a combination of specific hormones, a specific part of the autonomic nervous system, and specific emunctory organs or detoxification organs that are involved in the origin of a disorder. The one exception to this approach, of course, would be inborn errors of metabolism or traumatic injury. I put this chart here just for you to have a sense more practically of how we would consider this model of integrated physiology and disease. So, for example, if you look at the disorder on the second column from the right, acne, for example, involves an increase in parasympathetic activity and primarily the sex hormones in the gonadotropic axis. The liver and the gallbladder and the colon are also involved. So when all 4 of these factors are imbalanced, you're likely to develop acne. And even using a single plant like wild pansy, Viola tricolor, you can start to address many aspects of this disorder even before you've mastered all the specific details of how this disorder works. And in this table, you can see examples for osteoarthritis, for dry bronchitis, for tonsillitis, etc. So, for example, we take this plant, wild pansy or Viola tricolor, and we see that on our model of integrated physiology, that this one single plant works with dysbiosis, which is part of the acne terrain. With congestion of the skin, it helps drain that, helps drain the liver, it helps drain the lungs, it helps balance the immune system and the role of inflammation in acne, and it can help with wound healing where there's scarring from acne. So when you study the science of endobiogeny and then our clinical courses, you'll learn how to rationally select medicinal plants to effectively heal the whole patient rather than only using plants as a substitute for a drug. So let's talk about the practice of endobiogeny. There are 4 elements to the practice of endobiogeny: listening to the patient, examining the patient, evaluating their biomarkers as an indicator of physiology, and selecting an intervention based on a rational assessment of the first three levels of evaluation. So listening to the patient is about extracting information about how the hormones, the nervous system, the detoxification organs are functioning in the past, in the present, and what puts the patient at risk of future disease. Let's just take one example, which is the neurotransmitter noradrenaline, which represents the first part of the sympathetic stress response in the autonomic nervous system. When you're speaking to your patient and you see that they have a history of teeth grinding, of tense muscles, that they suffer from insomnia, and they have anxiety, already you know that noradrenaline is elevated in this patient. Examining the patient is about corroborating the information obtained from the anamnesis and discovering new information about the functional relationships of hormones in the nervous system as it expresses itself on the physical body. So if we stick to the example of noradrenaline, what might we expect to see on the physical examination? Well, if this is an older patient and they've had a long history of elevated noradrenaline, there's going to be deep vertical wrinkles on the face. Even in a younger patient, you can anticipate seeing injected sclera where the blood vessels on the sclera are dilated and easily visible. You could also see a strong response on glabellar tap if you do a thorough neurologic evaluation. The third element of the practice of endobiogeny is evaluating the blood work. Now, as physicians, of course, we order blood and we look at the results. But our habit is to simply see if the results are normal or abnormal. And if the results are normal, there's nothing we do to help the patient. From the perspective of endobiogeny, there is a functional way of analyzing the relationships between biomarkers, which reveals hidden imbalances or imbalances which are not readily apparent. So the proprietary approach we've developed is algorithmic, and it uses mathematical analysis. It's a functional evaluation of imbalances between many different systems in the body, and it helps us understand integrated physiology in a practical way. And what we're looking at is something called a drift pattern, which is how two or more biomarkers are drifting away from their optimal state of functioning. So the advantage of this approach over the standard approach is that it lets us look at the entire system, the whole person, as well as different types of functioning and capabilities. And it's objective, it's numerical, and it's qualitative in its relationships. So let me show you a little bit about what biomarker drift is. So if you take the thyroid hormones TSH and free T4, each of these biomarkers may be in their normal range, shown in green. But as you can see, the TSH is it's drifting into the higher end of its optimal range, and the free T4 is drifting into the lower end. In this case, the TSH is at the very highest level of its optimal range, but the T4 is gone into the suboptimal range of normal. So again, in this second example, in your basic evaluation, the TSH is normal and the T4, free T4 is normal as well. But the free T4 is suboptimally low. The TSH is optimal, and so the ratio is high, and that means something different than in the first example when the ratio was normal. For example, studies show that there's a higher risk of developing Alzheimer's disease or diabetes, or in diabetics having worse glucose control. So here's a case where the drift profile is high, but this time it's high because the TSH is absolutely elevated, and the free T4 is technically normal and optimal. So using this type of qualitative association between two or more biomarkers allows us to all of a sudden uncover all of these potential risks of future or active imbalances that would be missed if we looked at the individual results alone. So for example, when you have a lower TSH to T4 ratio, such as in this case where both the results are normal and optimal, it's associated with a lower risk of dementia and better glycemic control. So the system that analyzes blood work is an online system called Gemma Bio. It's a functional biomarker analytical tool, which you can begin using right away, even without training in our system. It uses proprietary algorithms to deeply understand imbalances for screening, prevention, and it offers diagnostic aid and therapeutic aid to help you derive more information and a more precise and personalized treatment approach. A wide range of conditions can be addressed at a lower cost than standard or quantitative functional lab testing systems. The GEMMA testing system offers the interpretation guide, intervention guide, recommendations on diet, lifestyle, and environmental modification, and it will discuss drug-drug interactions, drug-herb interactions, and herb-herb interactions to help you make the safest and most effective therapeutic choices for your patient. So here's an example of the adrenal balance panel. In this case, for example, you could obtain this information not by directly measuring salivary cortisol or salivary DHEA, but simply by ordering a complete blood count with differential and platelets, we can model or estimate the functional activity of cortisol and other adrenal hormones based on their tissue level activity, considering all of the epigenetic and environmental factors that can alter how cortisol and other hormones are functioning. This test is the thyroid quantitative screen. It involves TSH, free T4, and free T3. And it also provides the ratio analysis, as I showed earlier, the TSH to free T4, as well as the free T4 to free T3 ratio. So here you're not just measuring quantitative output, you're also looking at the dynamics and the qualitative relationship between thyroid hormones, which itself is also very relevant. So there's many other panels: allergic panel, immunity panel, inflammation tendency panel. Most of what I'm showing you here only requires a simple blood count, and you can use the same count to order multiple tests on your patient. You can also do a screening for anxiety with just a simple blood count. This is an example of what you might find in the report. This is the thyroid quantitative analysis. So here we're not just presenting the results that you provide from the lab, but we're also determining if these values are optimal or suboptimal within our system. And our system derives these optimal and suboptimal ranges based on aggregating several clinical studies to determine the functional normal range rather than a standard statistical normal range. And so, for example, there would be recommendations based on the results where you could select seaweed or Irish moss or various minerals or amino acids. There's dietary recommendations to guide you through. Here's an example of one of the dietary recommendations. If your patient has hypothyroidism or has functional hypothyroidism or sick euthyroid, you could recommend this diet. to provide the nutrients just naturally through food that would help the thyroid work more efficiently. This is an example from the same thyroid report where we discussed different types of lifestyle issues that can affect thyroid function, as well as organic pollutants and what you can recommend to avoid exposure to these pollutants that can affect iodine uptake and thyroid hormone metabolism. Here's an example from the same thyroid panel with a table presenting different medications that can have iatrogenic effects towards hyper or hypothyroidism. And there's also a brief clinical review indicating the signs and symptoms, both classical and subtle or functional, related to a weakness or an oversensitivity to the thyroid hormones. And then finally, at the end of the report, there is a discussion of how the indexes were created. It cites various clinical studies so you can learn more about our approach. So how does endobiogeny and this functional lab testing compare to other testing services? Now, these costs are for the United States in US dollars, but they provide a general sense. So for example, let's take this middle one. If your patient has a fatigue pattern, which is related to adrenal fatigue, and they have palpitations, you could order salivary adrenal hormones, and that would cost about $150 in the United States and take 1 to 2 weeks to get the results. And in the meantime, you're either not treating your patient or you have to treat them empirically, and then you might need to revise your treatment. But with a simple blood count, which can be ready in a single day or a few hours, you can order the adrenal balance panel and have multiple levels of evaluation for as little as 15 US dollars and less in Romania. The same thing for anxiety screening and looking at other types of spasmophilic or inflammatory disorders. So when it comes to putting all these concepts to practice, the coherence of the history, the physical examination, and the biomarker analysis allows you to make a rational selection of any intervention you want to use. Our role is not to tell you how to treat, but to show you the most rational ways of treating the physiology as the root cause of the disorder, rather than only suppressing symptoms with medications or only suppressing the symptoms of pathophysiology with medicinal plants. So you could use any of these types of interventions: lifestyle, vitamins, minerals, intravenous nutrition, therapeutic diets, digestive enzymes, plants, mushrooms, homeopathy, acupuncture, osteopathy. Whatever you want to use is your choice. We just help you make that choice in a rational way. So how can endobiogeny benefit your practice? Because endobiogeny is an approach to medicine, to modern medicine, it's transposable onto your current expertise. It's not imposable. You can be flexible in how much of the history, how much of the examination, and how deep the biomarker analysis is according to your interest level. Learning endobiogeny will expand your knowledge base. It's going to bring profound insights and deeper knowledge, and it can support a transition to a more satisfying and lucrative patient-centered care model rather than staying in an insurance-based model and only having 8 minutes or 10 minutes to see a patient. It also helps you better address the quote-unquote unsolvable and untreatable conditions. With endobiogeny, nothing is untreatable. Everything is treatable. So here are the 4 essential points I want you to take away from the theory of endobiogeny. The first is that it combines holism and physiology through the process of integrative physiology. The second is that endobiogeny evaluates metabolism, which is the basic function of the universe and all living things, is constant transformation. The third is that endobiogeny is modeling physiology, which reduces the use of costly tests that take weeks to result. And it saves you time in interpretation and treatment selection by offering a guide that helps you interpret and understand more deeply your patient's lab results, and by selecting the most rational treatments. And finally, endobiogeny promotes patient-centered care, deeper insights, and a greater range of treatment options. So to conclude this first part of the talk, let's place endobiogeny within the panoply of other approaches to healing. So endobiogeny is this systems approach thinking, and the current biomedical model is a non-integrating approach to physiology and cellular biochemistry. Now, functional medicine, from my perspective, is holistic biochemistry, not holistic physiology. So it's very focused at the cellular level, which is important to understand, but it's not always able to go back up to the global system. And then orthomolecular medicine is functional biochemistry. But the theory of endobiogeny incorporates all of these approaches in an integrative physiologic-based approach to systems thinking. Now we have these pre-modern whole systems medicine approaches like East Asian medicine, Ayurveda, and Tib Unani. And what I would say is that while the theory of endobiogeny is not based on these approaches, we respect these approaches and the holistic frameworks that they use to heal. Because the advantage we have is the ability to quantify imbalances, so not through pulse diagnosis or tongue diagnosis, but through biomarker analysis. And we use a modern language to discuss the results and a modern rational way to select the interventions. But the theory of endobiogeny embraces all of these approaches, ultimately. All right, thank you for your attention. Now we're going to go on to part 2, which is to briefly talk about the opportunities to train with us and learn about the science of endobiogeny. So in order to take this course, we find that it's appropriate if you already have an interest in holistic medicine or you were interested in learning more about holistic medicine. If you're interested in healing your patient rather than simply treating their symptoms, this would be a good course for you. And if you're looking to transform your practice for greater enjoyment of medicine and patient-centered care, this approach is for you. The Science of Endobiogeny course is a 6-month course. There's 1 module per month. There's 2 to 3 topics per module. There's a guided reading and a self-assessment test. We have pre-recorded lectures by myself and other experts in the field that will not only summarize the chapters you're reading, but immediately provide clinical context and clinical insights. So right away, you start to understand how the theory is applied in practice. There's an experiential center that's experience, which has also been pre-recorded, where we use the GEMMA functional lab analysis system and case studies to again show you theory in clinical practice. And then finally, there's opportunities to become certified through testing and to receive a diploma. The tuition for the course includes all the material you'll need. You'll have an electronic version of the Theory of Endobiogeny textbook, volume 1. There's also supplemental reading material that's provided. You'll have access to the workshop and case study recordings. The GEMMA Explorer subscription is not currently available, but you can add that on at any time, your choice. You'll have access to the course videos actually now for 12 months after you sign up for the course. So for a total of 18 months, you can review this material as many times as you want. So the general topics that you'll find in this course are the concept of systems theory, integrative nervous system analysis, integrative endocrinology analysis, integrative physiology and integrative metabolism, anamnesis and physical examination from an integrative physiologic perspective so you understand what these signs and symptoms mean, and the scientific basis for the mathematical modeling approach we use. We'll discuss the science of medicinal plants and how they can be helpful in clinical practice, as well as the principles you can use to select the type of plant, the form of the plant, the dose, and the duration of time. The types of topics that we'll discuss in the experiential or practicum include functional thyroid analysis, autoimmune thyroiditis, adrenal imbalance, global functional endocrine survey, and evaluation of the stress response through a concept called spasophilia, which is the basis of many, many disorders. And at the end of the course, you'll learn how to manage complex disorders with various comorbidities. There's many ways to be certified. You can take a multiple choice exam. You can take an exam with an essay to be certified with mastery. Or for those who are really interested, you can take the exam and also write a monograph or present a case study for exceptional mastery of and contribution to the science of endobiogeny. And if you choose this pathway of excellence, we'll be there to support you with the research study and the publication of your work. If you want to learn more about this course or our upcoming course in clinical endobiogeny, you can visit us at this website, training.systemsbrg.com. You can learn more at our general website, and you can explore the GEMMA system at gemmabio.com. Thank you for your attention, and I wish you all a wonderful seminar. And I want to thank Dr. Camelia Obar, and I want to thank our friend, Mr. Paul Alinea from Zenith, for sponsoring this seminar. Thank you all very much.